Hi guys, and welcome back to the show. Today I'm going to talk about how you can fix low back pain with numbness. Now, hello and welcome back to the Stretch Mobility Coach YouTube channel, and I am Kim Nartker. I help people experiencing pain and tightness get to the root cause of the problem in order to fix it long term. And today I want to better help you understand how you can fix your low back pain, and if you have numbness, fix that as well. Now, I want to talk about first what is considered to be the low back. The low back actually consists of 5 lumbar vertebrae that also consist of disc between each of those vertebrae and nerves that come out the backside of the spinal cord. Now, the nerves are very small when they come out of the spinal column, and these nerves come through the foramen in the pelvis, and the size of the nerve that when it comes out of the pelvis is about the size of a nickel, and this nerve travels down the back of the leg. And what causes numbness in the low back is when a nerve is actually compressed due to degenerative changes, numbness can occur. And the numbness can occur over various areas of the lower leg depending on where the nerve is compressed. And it's going to take a skilled practitioner to find where that nerve is compressed for you. Now let's talk about what you should be concerned about if you have any numbness. Now, any pressure that's placed on the nerve that causes numbness needs urgent attention and care until the numbness is resolved, guys. And if you're not getting resolution, you need to get to a provider that can get that numbness resolved quickly. Nerve damage can actually occur when the numbness is left untreated for too long. Now, the treatments that can help your numbness, physical therapy, chiropractic care, both alleviate numbness effectively. And when you have gone that route already and you've not seen the results that you're looking for, then you can look for results from a stretch mobility coach, and we can provide you with a treatment program that improves the numbness more long term in order to keep you away from surgery. Now, typical prescribed treatment that may be offered as a solution to nerve numbness, well, let's break each of these treatments down. One of the treatments is physical therapy, and a lot of physical therapists are trending in not only doing exercise, but they're also doing a treatment technique called dry needling. Now, this is a modality that can alleviate pain and tightness, and its typical use is sort of a long-term strategy to relax the muscles and take the pressure off of the nerve. And if you're doing dry needling, you're going to have to do that repeatedly just to be able to take the pressure off. Now, another solution may be strength training. Many people will tell you that if you build up strength so that you can take the pressure off your nerve, that will help decrease numbness. And although this is true, a skilled clinician is going to be required to address any nerve pressure in order to avoid long-term effects of a nerve compression. So just going to see a personal trainer and hoping that your personal trainer will figure it out. Guys, it's putting a lot of pressure on a personal trainer, and they haven't got the clinical skill set to be able to relieve that fast enough so that you don't have irreversible damage. Now, stretching can be done, and you can stretch that nerve and the muscles, and this is going to provide you some relief from numbness. But if the stretching doesn't take the numbness away, you're going to need to address that through a more skilled care provider. Some of your other options are going to be pain management. Options such as cortisone injections, nerve ablations, both can be offered to relieve pain from a nerve that cannot be resolved with conservative care. Surgery is actually prescribed when your insurance company will approve surgery. But did you know that if you have not tried conservative care, you can actually get a second opinion if you don't feel like surgery is your next option, or maybe you want to delay that surgery a little bit. Your preventative options to avoid surgery are going to be seeing a stretch mobility coach. Now, when you're seeking care for low back numbness, here's a few questions you can ask your provider to see if the treatment you're going to receive with them aligns with what you're looking to achieve. First, you need to ask if this treatment will last you and keep you away from returning pain or returning numbness or even surgery. And then you can ask them how long you can expect to see results from your numbness, because you want that numbness to be taken away as soon as possible. And most providers that do things long-term will have a maintenance plan that are going to help you to continue to progress after you've taken the numbness away. And they're going to be able to provide you a treatment option that provides a way to rebuild the muscles and rebuild and gain mobility in those joints that are putting pressure on those nerves. And if your provider can't say confidently that they can do all of these things in all of these areas, then seeking care from a stretch mobility coach can answer these questions and provide you with a treatment option that is more long-term focused. Now, here's what I focus my time on right now. I teach PTAs to start stretch mobility coach practices all over the U.S. And we provide a comprehensive training program for them so that they can help you take away that numbness as quick as possible and then rebuild your musculoskeletal system. My proven program, it's called the Stretch Method. And if you're looking for long-term results, you can search for a stretch mobility coach near you by going to www.thestretchmobilitycoach.com/find a coach. Now, I'll put that link below here so that you can click on that to go straight to see if there's a coach in your area. Now, when you're talking about numbness, then typically that numbness comes from degenerative changes. But before you have those degenerative changes, your body typically has what we call a joint restriction. And a joint restriction is found between two joints. And a joint is where two moving bones connect. And these joints are supposed to be mobile. And when they're not mobile or strong, this leads to compensation. And this particular compensation in your low back causes you to be at risk for problems like numbness. Now, joints that pinch the nerve are typically in the cervical spine, thoracic spine, lumbar spine, and pelvis. And when a joint is restricted or it's tight, locked up, or lacks the normal mobility required to function, this dysfunction can cause numbness to occur when the nerve is compressed by the joint. For example, so when your joints are restricted and they're weak, and I'm talking about your joints of your hips and your low back and your pelvis, and let's say you have joints that are restricted and you don't know they're restricted, and you bend over and lift an item off of the floor, and maybe it's just, a couple of pounds, so it's no big deal. And your joints and muscles don't have this mobility or the stability to lift. When you come back up, you can actually have your joints locked down, and your body may not tell you that your joints are locking down. You may not get up till the next day, or it may be the next week that those joints knock down, and then you start feeling some numbness and you start thinking back to, okay, what did I do yesterday that caused this numbness? And what happens is this is sort of a cumulative effect. When your joints in your body are not moving correct and your nervous system sends the response to the joint or the muscle to try to allow you to do the activities that you like, and it does it for so long and it doesn't have the ability to move well and it doesn't have the stability, and then you have degeneration that occurs in there, and that degeneration could be just arthritis or it could have advanced to degenerative changes. When you have this actually decreases the space between the vertebrae and the nerves, and it compresses those nerves, and that pressure actually causes numbness. And if the pressure is on the nerve, it's important that you relieve that pressure as soon as possible so that long-term damage to the nerve does not occur. Now, most of you are asking, can I resolve my numbness long-term without surgery? And the answer is yes. If you can decrease, or when you decrease the inflammation of the nerve by improving joint mobility in the area of the nerve compression and above and below that area, you can actually get complete restoration of the nerve before the damage is too severe. Now, if you see a doctor, they're going to likely run tests like x-rays, MRIs, and CT scans, and they're going to be looking to see if there's a more serious problem that is causing the nerve to be pinched. Now, if your nerve is compressed by a joint dysfunction, many times these testing procedures are going to come back showing that you have arthritis or you have degenerative changes. Just because you have degenerative changes and you have numbness, it doesn't mean that it requires surgery or that surgery is your only option. So let's dive a little bit deeper in this. Not all numbness requires surgical intervention, and most likely your doctor is going to send you to see a physical therapist when you're diagnosed with numbness. And a physical therapist is going to perform an extensive evaluation and develop a program that is covered by your insurance company. And the focus of this care is going to be to decrease your pain and take the pressure off of the nerve as soon as possible. Now, if you attend your physical therapy and you don't see long-term results that you're looking for and your numbness is not resolved, then you're going to probably be told, well, your only option then is surgery. And guys, I want to tell you, just because you check the boxes for surgery doesn't mean that surgery is your only option. You can actually seek care from a stretch mobility coach, and we can pick up where your physical therapist ended and provide you with a program that focuses on non-surgical, natural treatment. And in fact, the faster that you can improve the joint mobility of the thoracic spine, the lumbar joints, and help them to move in all the directions that are normal, and that you take the pressure off of that nerve, and then you reestablish deep stability of the thoracic, lumbar spine, and pelvis, as well as the hips, you're actually going to be able to keep the pressure off of that nerve. You're also going to be able to keep the degenerative changes from advancing any further. Now, some things that you can do today to prevent: you need to get your joints checked out to make sure that you have healthy joint mobility throughout the body. You also want to get your muscles tested to see if your muscle strength in those deep muscles are enough to stabilize the joints, and make sure that you have the flexibility that you need for those muscles. You can eat less foods that cause less inflammation. You can sleep well. You can improve your cardiovascular system, strengthen your musculoskeletal system, and then you want to shut off the chatter in your mind and work through mindfulness and relaxation techniques. Decrease stress by being authentic when you speak. And you can also utilize a deep thermal laser, if a place has it, to regenerate and heal the cell around the low back area so that you can decrease the nerve sensitivity while regaining joint mobility and strength. Now, proven ways to relieve a numbness in the low back naturally and for good: you have to actually break the muscle deconditioning cycle, because this cycle is actually going to cause further joint damage and muscle weakness, and then ultimately lead to muscle deterioration. This cycle, as it continues, if it's not broken, you're not going to be able to take the pressure off of the nerve, and the longer the pressure's on the nerve, the longer you're going to be at risk for damaging that nerve, and then surgery may be your only option. I do always recommend that you get a second opinion and come see a stretch mobility coach if you want to see if conservative care can help you. Now, the stretch method has developed a proven process that's going to take you, if you're experiencing numbness or pain in the low back, and we're going to be able to test out some things and develop a successful program that actually relieves the numbness, relieves any pain, and improves the joint mobility in the hip, the low back, and the pelvis. And this treatment is going to focus first on finding where your pain and numbness is coming from. A stretch mobility coach will develop a program based on your signs and symptoms, and they're going to look at your current joint, your nervous system, and your muscle health to see if there's any deterioration. And they're going to do this at your consultation. And then they're going to work with you until your joints, muscles, and nerves have been restored to their full potential. And once this occurs, your stretch mobility coach is going to recommend a maintenance program that focuses care on keeping your joints, your muscles, and your nervous system at its peak so that you will always be able to avoid surgery. Now, a stretch mobility coach is certified in the stretch method, and a stretch mobility coach is a licensed professional, typically a PT or a PTA that has a current license, but they've stepped aside and taken an extra post-degree training program that is able to help them treat more long-term and use natural treatments outside physical therapy. Now, you can find a stretch mobility coach. I'll put a link below, but you can go to our listing at thestretchmobilitycoach.com/find a coach. And if there isn't a coach in your area, don't worry. You can actually request a coach in your area. And if you need urgent help, we can get you somewhere so that you can get the numbness resolved. Guys, thanks so much. I hope this video was helpful for you so that you could better understand the low back and what's going on so that you can resolve that low back pain and the numbness for good, and so you can get back to your life.